podcast. Let me quickly introduce the panel. We have with us Dr. Ratna Devi, who's founder and CEO of Dakshama Health and Education. She is very much at the heart of patient advocacy. Welcome, Dr. Ratna. Hi. We also have with us Dr. Usha Iyer. She is Director Communications at Dr. Reddy's Laboratories. And I'm very pleased to have you here, Usha. Welcome.
Thank you. Thank you.
We also have with us Dr. John Victor. He's the founder of Reevin Mental Health Services. And I know someone who's really worked very hard to make clinical counseling available in an online format in multi languages. Welcome, John.
Thank you.
I'd also like to lastly welcome, and it's a real pleasure that Dr. Amir is with us as well today to join the panel. Dr. Amirullah is a health economist. It's a rare kind of intersection, and I'm very pleased that he'll be able to add further perspective on the panel. Welcome to all of you. Let me first start with Dr. Ratna, as we rightly should. Dr. Ratna, given the findings that Brian has presented today, how would you react to the points raised about patient education?
Thank you for that question. And so in order to understand that report better, we probably might need a little more context of who answered those questions. Was it private sector HCPs or public sector or combination of both? Also, it seems to be predominantly answered by HCPs, and I was wondering if any patients and patient groups were also asked the same question, because what were the differences in perception if HCPs were responding to a question vis-a-vis patients. However, the results are very encouraging, and it's good to see that there's a lot of, sort of expectation on improving communication, patient engagement, patient-centeredness, etc., and that HCPs are actually demanding for such things from the innovator companies and the biopharmaceutical companies. Having said that, the way patient engagement is perceived and understood and delivered in the context of India is extremely different from how it is done in countries where the health literacy levels of populations are way better than what it is in India. So I would be very interested to understand how, what is being requested for would actually translate into better patient engagement in terms of improved services, improved communication, and improved sort of engagement overall across the patient journey touch points in every section of what the patient goes through once they are diagnosed or once they are aware of a disease, to if there is a treatment, then they are treated, or if there's a lifelong management, then they are managed. Because that would really be important to understand what is it that they really mean when they say that we want companies to be more patient-centered. From the perspective of patients, I think we have a long list of what we want from the companies. Currently, it is more market and product driven. We want communications and engagement to be product agnostic and market agnostic. We don't want people to come to us saying, "Hey, we have cancer treatments. Would you want patients to engage with us? Hey, we have Alzheimer's treatments. Do you want?" No, we don't want that. We want you to come to us irrespective of what you have in the market. And if you're really patient-centered, engage with all groups to have common communication that is useful to all patient groups. So I'll stop there because there's many things that I can talk about, but we can touch that later.
Thank you, Dr. Ratna. We'll come back to you. And I think that totally goes to what Brian had mentioned, that patients want as little as 19% to talk about the product. So I think that what you said completely endorses the results. Brian, could you help us understand what Dr. Ratna raised about? Was it all private sector HCPs, or was there any element of government participants, before I go on to the other panelists?
I don't have that information immediately available. I'd have to go back and check. We might not be able to ultimately get to it because there is a level of screening and anonymity in surveys of these kinds. But I do agree with your points about each of these markets are very different in their regulation, literacy, setup. I think if anything, it sparks a question, a conversation that needs to be had between healthcare companies, communicators, government, industry at large of how to continually keep improving along these lines, but definitely some encouraging support from the HCPs themselves that, they do want to hear more about these initiatives and I'd imagine carry them through in their day-to-day.
Thank you, Brian. Yes, I think because of confidentiality, we may not have all the data. It's quite likely that in India, it may have been private sector driven. It's quite likely. So I'd now like to speak to Usha and then John and then Dr. Amir. Usha, given what you've heard that there is no silver bullet really, and there's no indicated approach like this channel, apart from the umbrella view that digital is important, how would you like to share your experience on how corporate communication for healthcare it has evolved and what kind of impact it has?
Absolutely. Thank you, Parul. And already it's been, like Dr. Ratna also said, very encouraging to hear what Brian presented, the findings, and extremely educational. And in turn, it was also very just in the 5 minutes that Dr. Ratna shared her views, what she said about, being product agnostic and engaged just to learn more as companies has been a big learning for me also. So I approached this talk from the point of view of sharing my experience as a corporate communications professional and also in the spirit of learning and taking away what I can from here. So as a communicator, the first disclaimer that everyone has to learn is know the laws and boundaries within which you operate. This applies as much to India as any other country that we operate within. When it comes to product communication, the do's and don'ts and the laws that govern what you can advertise, what you cannot, the claims that you make, the pricing strategy, etc. There's a lot of rules in place. For OTC products, they may be different, but for prescription products, know the boundaries within which you operate. They exist for a reason. Is something that my teams and I constantly tell ourselves before we get into any planning or campaign planning or communication plan of any sort. The biggest and the most important things to know, as I'm sure everyone already knows, and so much of that was covered by Brian also, is as a communicator, know your stakeholders, know your target audience, and know the messages you want to drive. When we say stakeholders or target audiences, of course, healthcare professionals are stakeholders, patients are stakeholders, governments are stakeholders, but equally so, potential partners, collaborators, regulators. As a communicator, there is an entire universe of stakeholders that you're targeting. But I'll just come to that in a slightly more segmented manner. So while we know there's a universe of stakeholders, we also know the media, the channels or the platforms through which we communicate with them. You have your regulation press releases, press conferences, you schedule interviews. There's mainstream media that covers a lot of things that they think are of sort of umbrella importance to large audiences, reading patients and the general public. They exist in metros, they exist outside metros. India particularly is a very segmented country. So again, knowing your target audience, knowing whom you're speaking to, which patient, which healthcare professional, what socioeconomic factors they operate within, extremely important. And here's where again engaging with stakeholders again and again comes to the fore. You have social media in today's age. You have multi-channel campaigns that companies run, and of course you have brand equity studies similar to the report that we just heard that companies can also conduct to find out where they stand when it comes to their products as well as corporate reputation. One of the first learnings that I learned, it's not the first, but it's the more important in recent times, is you have to keep evolving as a communicator and as a company, and you need to team up with different teams, even within your own company, to deliver the best impact and really understand, whether you have your finger on the pulse of the person you are aiming to address or not. So I'll come to that in a segmented manner. By that, what I mean is, one, there is this corporate umbrella, corporate reputation. That's the reputation of your company as a whole. And so much of what both Dr. Ratna and Brian alluded to lies in that space. It's beyond one product, beyond one brand, beyond one therapy segment. It's what your company stands for. Your lay readers, patients, healthcare professionals, partners, collaborators, regulators are all interested parties in this. Here's where you talk about your current presence in the business, what you're doing, how you're doing. We get questions around from all of these stakeholders, particularly even healthcare professionals, actually, on our financial performance and how the business is doing. Future aspirations. Brian mentioned going beyond medicines and offering a lot more. your current spaces as well as your future spaces, because a lot of companies are saying a lot about building the healthcare of the future and ecosystem of the future. There's a big role that digital has to play, end-to-end disease management. There's wearables and other gadgets and so on, technologies coming into play for healthcare. So what you're doing currently, how you're making a difference, and what you're doing to build the future of healthcare or address future needs is something that we get questions around. And of course, one devises a whole roadmap and strategy of communicating to the external world how we mean to carry out our business in a robust manner. Because in the end, Brian's points alluded to that actually. The healthcare profession needs to have that kind of a trust in the company's performance as a business, its integrity, its ESG, its governance, and so on also. So how do you mean to get, and you need to have the confidence that this company is going to deliver the product or is going to deliver certain objectives in a certain therapy area for you to be able to develop trust. Differentiators, very, very important. What you're doing in terms of patient support, what you're doing as a company. Brian mentioned ESG, and that really caught my eye because that's something we, one sees the more ESG becomes central to your business, the more meaningful it becomes. Gone are the times when you could treat all of these as separate sort of things that you talk about. Your ESG has to emanate from your business. Putting patients at the center of your business goals is the only way you can hold yourself accountable as a company. So if your ESG goals have a certain percentage of innovative products, certain access numbers that you're giving yourselves, particularly in markets where access is low, that's a real difference-making ESG goal, as opposed to simply sort of taking on what seems like a feel-good kind of a goal to take. Of course, so generally we try to work around how we're doing in segments, how we try to do our plan our future and so on, and the differentiators. Then comes the entire brand and product team. Here you have healthcare professionals and pharmacists, chemists as your stakeholders, your target audiences. Everything from the categories and therapies you play in, the rankings of the market, your work against the market leader. Have you benchmarked yourself well? Have you understood the segmentation of the market? What are the unique features of your product? In the end, I'm sure Dr. Ratna will also share. In the end, it's your product that needs to deliver the goods. So do you know the science that underpins your product? Do you have a robust product at hand? The clinical soundness and efficacy of the product is the most important thing. Do you understand your patient profiles? And when I say patient profiles, immediately I would have thought of a product related conversation. What Dr. Ratna said was, have product agnostic conversations as well, but understand and engage with groups and understand their profiles before you start planning your communication. Real world evidence. Are you doing enough of real world evidence gathering? Do you know what patient experience data is telling you in order to make yourself a better company and more effective at producing your products? Patient support and information, even visual aids that we make for doctors. Has to be made basis feedback of the doctors. What captures their share of mind, what helps us with penetration, building better relationships, building better differentiation as a company. So these are something that we do at the product level. And the last point I want to bring out is industry association. There is so much that happens, not just at the corporate company level or the brand or the product level, it happens at an industry level. We know enough industry associations that operate within India. There are also sort of global industry associations that work in the pharma and healthcare space. These largely address policymakers, even patient advocacy groups, patient support groups, that we can, to the extent that we can. Again, it ranges from familiarization with the industry to achievements of the industry, to maybe little known facts about the industry. So for instance, did you know that 40% of generics supplied in the US come from India? That sort of market share kind of things. Also, the fact that quality or safety is not compromised because you are a generic product or a lower priced product. The fact that there is savings to be garnered to economies in switching to certain options. These are all themes, these are all messages to send out at an industry level, and submissions made towards policy. If there's an R&D policy being crafted, are you as a company using all of this data that you've gathered to make your submissions, to make it a more innovative ecosystem so that you can make better products? Are you inputting and working with the government and stakeholders on this? So globally, the perception of pharma varies widely. There are some markets, of the 6 markets that Brian mentioned, there are some markets in which pharma is referred to with sort of one, the same brush stroke. Pharma may be seen as the bad guy, profiteering, and there's a sort of exorbitant pricing going on, whether you're a generic player or an innovator, originator pharma. In some markets, there's a better sort of perception of pharma. There are some where, pharma is hailed as a hero or somebody who stepped up when it mattered. So again, there is a lot of, chopping and sort of studying the data more and more that you can do. But the industry level is another area to aim for. I'll just end by saying this much. It's a learning curve. It's an evolving profession. Through the pandemic, before and especially after, I mean, in the sense, at least after the 2021-22 period, so much of what we've learned has centered around also battling miscommunication, myths around products, myths around categories, myths around therapies, rumors. Think the pandemic time, the swirling information that there was, there were always immediate updates being given out in the public arena. There was a lot of information, misinformation even, about products and treatment protocols and so on. This was a time brands perhaps should have probably more, but now we're learning, done a better job of communicating, the do's and don'ts and what is correct, what is not, what is happening directly to the public, directly to the patients. Again, speaking on behalf of pharma, we see this move to go, especially in India, to go from traditional pharma offerings to more sort of holistic care, nutrition, well-being, going beyond the pill. There's a lot of untapped potential here when it comes to communication, I feel. We're still learning. We still don't know how this will play out. We're still planning for the future, but there's a lot of untapped communication potential here with all the stakeholders that we've discussed. And one thing is more simplification, more clarity, less jargon. These are lessons that we as communicators are also learning. Tell us in simple terms how your product is going to make a difference, how you're planning for the future, how your ESG goals actually help the people, planet, purpose, how you as an organization are working towards constantly keeping your governance standards high. Be simple about it. Less jargon. Don't try to obfuscate your audience. That's a big learning for me as a communicator also. Think stakeholder first when you're planning your communication. Don't start from yourself. Think how it will actually help the listener understand what you're saying and work a communication plan. So it's a very humbling profession often, because you start off thinking, I know so much, I've worked for so many years, and then next thing you know, the whole landscape changes and you have to keep evolving. And I think reports like this are a big way for us to learn and grow as a profession.
Thank you, Usha, for that very detailed recap of the challenges of corporate communication. I do want to come back to you and to Brian about this whole issue of science communication versus science or wellness influencers. The pandemic threw up major stars like Dr. Fauci, the AIMS director here, who became stars, which is never actually seen before. So I'd like to really come back to the issue of science communication per se versus impact communication. I'd like to now bring in John. John, you're the one person on the panel who actually deals directly with patients in the sense that as a clinical counselor, you also work with psychiatrists when it comes to medication prescription, though you yourself do not prescribe. What is your perception about how do patients look at pharma firms and medication?
Unfortunately, there are two important things here. I have an experience working with Sparsh, which we started in 2008, and I was associated with them till 2013. That's a patient training program, support program. Basically, the people who have diabetes and they put on some medication by the doctors, and they can actually call this Sparsh center, and some other counselor actually help them in terms of how to deal with their behavioral aspects, in terms of their exercise, in terms of their diet, in terms of medical management. And we are able to see a lot of things in terms of coming from there. And that's one experience I have. And other experience, what I'm actually witnessing currently right now, it's a mind-boggling kind of disturbance right now, because the kind of information overload what we have for the last 2.5 years, after the COVID, and more than truth, which is actually circling around right now, we actually see misinformation so much. When misinformation is so much, what happens is your mind actually, information is to empower people, right? But the kind of information what we actually get is actually not empowering. That's actually crippling our cognitions in terms of what to trust, what not to trust. I have both the informations, one side which is going to help me, other side which is going to mislead me. But I'm not very sure where to trust, what to actually do. And many people doesn't even know the reputed kind of websites or reputed kind of people who are actually giving the information. In that situation, what many people actually do is they go ahead. The age-old kind of theory which actually comes here. They go back to their treating doctors and they talk to them. Doctor, this is what is actually happening. If the doctor prescribed in India nobody questions. That is the age old stuff. But now that's not true. Even the doctor prescribes, immediately they go and check out on the Google. They understand that the side effects and everything. And suppose if the doctor tells, but I have personally experienced with some of my clients, they come and said, I went to like my particular doctor, and the doctor said this medication is going to work for you, and trust me, this is going to do amazingly very well. And after using that medication for a month or two, when they find things are not working, they actually change the doctor. They don't want to go back to the doctor again. So even here, doctors also require some kind of training in terms of what to talk to the clients, what to talk to the patients. You can't just tell, take this medication, things will be all right. Explain them in terms of how this medication is going to work with you. I mean, what kind of side effect it's going to cause and how you need to deal with that. And probably if you actually can put it in forward like this, may use this medication if any problems or challenges are there, I mean, get back to me and we'll work on those things. So that's why even the doctors need to enhance or build their trust with the client community. That is eroding currently right now because of, there's so much of information overload. And now, as whatever, the presentation which is given and what Usha actually spoke, Dr. Ratna spoke, I mean, it's very clearly, tells very clearly, even your medication is absolutely good, probably the best of the molecule, but it may not guarantee that medication is going to be successful. Why? Because there are so many companies are there, thousands of companies are fighting for the same pie. And now here, what actually makes people to trust this particular medication? Right. Now, one route is doctors directly. Other route is what the company actually stands for. Right. Many times you actually, sometimes company, we actually come across, I work with, I think, most of the pharmaceutical companies. I actually come across some companies, they actually good, they spend millions of dollars and make beautiful websites and put all data there. But how many people actually go and read that? Not many people. So immediately, either they talk to other patients when they are going to the OPD, they sit with the next person. आपका problem क्या है? Diabetes. कौन सा दवा ले रहे हो? I mean, ये दवा ले रहा हूँ. What are the side effects? They actually get the, from the patient also. Now, when the patient actually tells something negative about that, they also develop negativity. Why people are actually trying to look at these negative things? Because, we are hardwired to look at the negative things and dangers much more than positive things and best things. In the process, if anybody actually give misinformation, out of you have like 10 pieces of information which is actually correct, but two people actually give misinformation, that's enough to influence the positive effects of good information. That means companies have bigger responsibility to play a major role in terms of actually building an ecosystem in terms of patient support program. When we talk about patient support program, you need to involve the doctors also as a part of that and engage with the patients in terms of not just talking about the medication, but also help them in terms of how to deal with the side effects, how to deal with their lifestyle modifications. Because only the medication doesn't really work. I mean, a lot of time we actually come across a lot of patients. They take the medication, but what they are not supposed to do, they also do those things. What they're supposed to, they don't do those things. If you actually integrate those things in a 360 degrees, format, that actually also build a reputation directly with the company. They don't have to go through different channels in terms of trusting, because until unless you build the trust, probably in 21st century, not many companies are going to make a huge kind of difference in people's lives. That's what my experience actually taught me.
Thank you, John. I think that's wonderfully put and really helped us understand the psychology of what the patient is going through, and also how the company can become a one-stop shop for all the information they need. So that was extremely useful. I'd like to take the discussion back to Brian and Dr. Ratna. Dr. Ratna, a question for you. Patient advocacy in India is very complex, given the various levels of society. There is not only class but caste and religion, poverty, gender. There's so much of segmentation, and you see that very clearly when you look at advocacy for tuberculosis, HIV/AIDS. We saw that in COVID as well. So, given this kind of segmentation, what do you think are the major challenges in patient education?
In patient advocacy?
Yes, in patient advocacy.
Um, so
How
this,
would you say that what is there's no, of course, one stop solution to all this, but in your opinion, what John also mentioned, building the entire ecosystem, are we moving towards that kind of approach?
so we will have to look at a basic question of what is it that the patients want. Is it
Yeah.
a medication that is serving a purpose? Meaning, is the medication that is currently available in the market good enough for them? Or are the HCPs telling them this will only help you for a few years, but after that you may have to change over to a new medication? Or are they saying this is only symptomatic treatment, it is not a cure because the cure is not registered in our country because it is too expensive? Or what is the message that is going there, and what is it that the patients then are looking out for? And that is the binding factor. So for example, if there is something that's not giving them a complete cure, but they know that there is a cure available globally, and trust me, patient groups are now connected globally because of social media and other channels. So they demand that this should be made available, and it's not coming into the country for whatever reasons, whether regulatory or other challenges, then the reputation of that brand will suffer, because then they will feel that we are not being given the best in our country. And while there are challenges in integrating all the stratas that you talked about, the rural, urban, etc., but I've seen that when there is a common binding factor, all those challenges simply disappear. Everyone connects, and social media is a great medium to get people to connect together, and we've seen that happening over and over again, especially when you have these expert sessions with healthcare providers who are really committed to the cause, and they speak in local languages and connect with their own patient groups so that the message is disseminated far and wide. You find people even from villages, tier 2 cities, tier 3 cities, joining patient groups, attending those patient support programs and webinars, and asking questions to the healthcare providers for answers. And it's a combination of how you reach them. It could be in-person meetings that are happening in these cities with the healthcare providers. It could be online meetings, etc. But I think those barriers and those challenges no longer exist. It's like one universal world as far as patient engagement is concerned, because even the most rural patients are searching the web to see if there are treatments available beyond the country, or if the treatments available within their city are something different from what is available, say, in a metropolitan city like Delhi. And they talk, they pick up the phone, they speak to their relatives, and they say, you know what, my doctor prescribed this to me. What did they prescribe to you for your condition? And then they ask questions. Why was I given
Yeah.
this, whereas somebody else was given something else? So I think those barriers and those stratifications no longer exist. Though we are a very complex country, and there are nuances to that as well. But I think patients are asking a lot of questions, and sometimes HCPs find it really challenging to answer, because they are either that particular market does not have the supply of that particular medication, or it is out of stock for some reason, and it's hard to explain to the patient why a particular choice was made. So I think communications or whoever is doing the outreach to patients or engaging in patient support programs has to be very cognizant of these factors, and not assume that patients are ignorant, and will not know that the communication or the messaging that is going to them is incomplete.
I think that's a very important point that you've raised, and it's really interesting to know that these stratifications are merging because of the use of digital. That's really useful. Before I go to Brian and Usha, anybody who has any questions, please drop them in the chat box. We just have a few minutes left of the panel discussion, so please drop your questions there. Brian, this whole issue of science communication in India, we have this sort of slightly odd situation where it's highly regulated market. But what is happening is that there are a lot of so-called wellness influencers who don't seem to, submit to any rules,
Yeah.
and slightly dangerous. I've seen sites come up who offer to treat everything from diabetes to cancer with herbal products. So this is fairly new, and it is only heightened post-pandemic. So how would you what would you recommend is are good practices for science communication, given its complexity, and how do you deal with the problem of wellness consumer influences?
It certainly is a very complex problem. I've seen from my perspective across different markets a variety of solutions, all of them having different levels of success. In China, for example, the government has been very strict about certifying any influencer that live streams or provides advice on law, medicine, kind of other verified areas, that they have to be first endorsed and their credentials checked, and then they can provide information on these topics. In Australia, which has a similarly highly regulated health system, the government has a slightly more lax approach to influencers. They only basically step in when there's real false claims or the advice that they're providing leads to a adverse event or a poor outcome with patients. I'd say government intervention, though, is only one of many options. It really needs to be an industry-led, and I mean everyone in the industry, collaborative-led solution. You need patient advocacy groups themselves, speaking up, as many have said on this panel, saying this is what we believe best practice should be. Then you need pharmaceutical companies, government, industry associations to step in and all come to consensus on what they believe the best next step should be. I don't know if there is a path from any other country around the world that I would say, yes, this is exactly what India should copy, because India is almost many countries within itself. So it might need to be a more locally led or even state or region led approach versus a national one to start with.
Thanks, Brian. Usha, last question of the panel discussion before I hand over to Chandra. Usha, the whole question which John raised about the entire ecosystem and how the channels of communication should really emanate from the company. How do you look at that, and what Dr. Ratna also said about patients discussing with each other? The point John raised about education of doctors themselves. What is your response to those kind of views?
I think it was a very, very informative discussion for those reasons. Since I know the time is of the essence here also, and we have a few minutes to go, I think this discussion has left me as a pharmaceutical company sort of representative here with a lot of takeaways to learn in terms of how to engage with different stakeholders. But in a landscape that changes often, I think the things that don't change are, on the one hand, and touching just on the question that we just discussed about misinformation or misleading claims or self-appointed sort of experts on various topics and so on, selling their wares. One thing that will not change here is that in the end, your science and your quality have to be solid on the one hand, and that has to come out very, very clearly. And the second has to be authenticity. I think Brian mentioned show and tell as this age of show and tell. You produce tangible results, measurable results. It has to be transparent. As Dr. Ratna said, as John said, as Brian said, this is the age of social media. You're going to be called out quickly. There are ways to punch holes in what you claim within seconds if you're if there's no show and tell, if there's no transparency. So the science and quality remaining at the center will not change, I think, regardless of what kind of offerings companies as companies evolve and have more and more sort of evolved pharmaceutical offerings. And the second has to be authenticity. That has to remain. You can only claim what you have and nothing beyond that.
Thank you, Usha.
Trust. I just wanted to say, so that in the end, this is the combination that earns you the trust of the stakeholder.
Thank you, Usha. So all those who are attending and even those who are not able to make it, we'll send you a copy of the QR code so that you can download the entire report. But thank you so much, Brian, Dr. Ratna, John, Usha. Thank you for joining us and sharing your views.